CEO here at the Rincon Indian Health, along with his facilities manager. And I will have all of you guys just introduce yourselves. Same spiel that we did previously, so we'll start on this side with Jessica.
Hello, I'm Jessica Vegas, Social Good.
Leadership, we present on a regular basis, and then also to general council meetings. So want to take a minute, first of all, welcome to the people that haven't been to this beautiful valley before. We have been working with Rincon Tribe and all our tribes on green energy projects for quite a while. And that's why I brought up, we did our first project back in 2009. We've done lighting audits. We're looking at all ways, and I love, one of our biggest social determinants of health is access to care and transportation. And I think you're going to hear that not only from tribes, but any tribal health program you talk to within the state. So right now we are up to 5 EVs, which is also a transportation van EV with a couple of fleet EVs, and then we have 2 Mustangs that also go out on a regular basis. So love to hear that change, and having so many CARB members up there is we talked with our board, and reducing carbon footprint is a big part of what's come from our tribes and back to us from our board of directors. So I just want to take a minute. I know you guys are on the Rincon Reservation. Chairman Bo Mazzetti passed away about a month ago. Huge proponent within his tribe for green infrastructure, reducing carbon footprint. Big supporter of Indian Health Council throughout the years, and big supporter of both Art and I, even with his history of going back through Bureau and then the Reservation Transportation Authority when he was even up in Temecula helping the tribes with that. So just wanted to take a word so you guys, proper respect there, and a vision that keeps on moving, right? He's one of the ones that set that vision for us. Also on the green infrastructure side and looking at alternative ways for energy. So again, real quick on our projects to date, and I'll let Art talk a little on the facility projects, the ongoing audit, what we do there. So 2009, we did our first small solar generation project, and it was also with X Energy, GGC at that time. That's how that relationship started. After that small project, we started looking at, we're a tribal organization, but we're still structured as a 501c3. That means never enough money to provide wellness services for our community needs and gaps. We're constantly looking at ways to, based on data, based on feedback to the community, to get as much wellness services as we can at IHC and to integrate those wellness services. So kind of went through, that ties back to vision, our mission, our strategic plan, and to let you guys know that reducing carbon footprint, green infrastructure goes through each one of our strategic pillars. So we were getting probably about 8% of our utility need out of that small generation project, and then when we did our bigger carport structures with solar, working with GGC, we're at about 60%. So we take those dollars of savings, we move them over to healthcare services. As simple as that. So while we've been doing that, we also have been pretty good at going through our facility, from lighting to others. I know Art's worked on a few audits. And then we're also looking at incorporating green infrastructure into any expansion programs we're doing. So we have the lot next to us. It looks like a small parking lot now. It's 5 acres. We're talking about the facility expansion into that, adding some more buildings, and with doing that, talking about making sure that we're as good to Mother Earth and the environment as we can be moving forward. And then the second piece, which Art has done a good job, is just the ongoing need for transportation throughout. So I forgot who mentioned it with working on Rincon, right? With moving moving
Yeah.
forward. I hadn't heard that one from council yet. What a great program and project to go. So anything we can help to reduce access to care for our patients, being in a spread out community. So we cover all of North San Diego County, about 1,800 square miles. So Riverside County border to San Diego City proper, all the way to the ocean and to the Imperial County border, huge service area. But we want those people to have as much access to care. So we do quite a few virtual visits, telephonic visits. We're trying to just any way to get them to be able to access healthcare services. So I know you guys are on a tight time schedule, and I just don't want to be the talking head. Do you want to talk just a few minutes on fleet
I
transportation?
think, so we did introduce, originally we got a transport van that had a wheelchair lift. We had an old van, old bus it was gas. It took some twisting an arm to get Mr. Hansen to donate it and get rid of it since we got the new one. You know, so we've been using that to pick up our patients that are wheelchair bound. You know, now we're able to pick them up, 100% electric. So we're using it, transporting them not only to our clinic here, but we also do transports to clients in wheelchairs to outside facilities.
Inpatient or specialty care?
Yes, we take them out. And with that, we also, through another program, acquired 2 Mustangs. I took the team's consideration. We needed a vehicle that fit a wheelchair in the back. So we took them out, we took a wheelchair to look at them. So the Mustang, they're fully electric. It fits a full wheelchair. Those are assigned for our behavioral health side, so they pick up patients to their behavioral health appointments. If they're wheelchair bound, they bring the wheelchair, it fits in the back. So they're all-wheel drive, so some of our areas are, you know, are still rough terrain, no cell phone service, so they're able to use those. And we also have 2 Ford Lightning trucks, fully electric, awesome trucks, yes. We use those primarily for in-house for transporting supplies up to our other facilities or other appointments. Yeah, we're using all those vehicles in-house.
What kind of funding, but how were you funding those vehicles?
So the 2 Mustangs were from I think it was called the CCMU grant. It was at the state level. There was a state grant for funding. We had another, so the van was actually funded through Citizens Energy, right, out of Massachusetts. So going back, we're just blessed on these old relationships. So Dennis McGee, who founded Indian Health Council and was our CEO, was actually a Kennedy Fellow. So the Kennedys were invested into healthcare in this area, Native Americans, right? So actually RFK Jr. was actually at this site in 1978.
Did the ribbon cutting.
And did the ribbon cutting.
That's right.
And Courtney were both here during that time. And that relationship has stayed. So it was actually Joe Kennedy Jr. at Citizens Energy that we started having the talk on what do you guys need? Where are you going? How can we help? So it wasn't only a van for us. In San Diego County, it was actually Southern Indian Health Council, our sister clinic that takes care of mainly the Highway 8 corridor, the Kumeyaay tribes down south. So we really worked together to try to bring as much funding into there. And then, of course, they're working with other impacted folks too. I know they worked in El Centro with Latino populations there and underserved. So right now we have built everything we've had mainly with grant funding. And like I mentioned before, it was important to us. We put about 1/3 of the project funding for the solar panels in the carport with our own funds. But we did that working smart too. So working with Rick, looking at that time, we signed up for elective pay. We are going to put in as a tribal organization.